All these, if any biomedical waste, if it is contain any infectious material like any bacteria, fungus, or any virus, like any pathogen that can cause disease to any healthy person, or it can be toxic to environment. That's why we have to concern about this biomedical waste. And when we come to the hospital waste, these are mainly two types: hazard and non-hazard. Hazard, it is around 15 to 20%, it is hazard, and non-hazard, it is 85 to 80%. Hazard waste mainly non-infectious and infectious. Non-infectious এর মধ্যে যেগুলো আছে সেগুলো হচ্ছে chemical and others. Chemical waste, it can be generated from housekeeping, hospital cleaning purpose, all those things. From this portion, the chemical waste can be generated. And infectious waste mainly from any patient body fluid, or any infectious material that is also, that may be sharp. Previously in first class I have told about needle stick injury, blood and solid, that is blood bag, like that, without needle, syringe, those are solid waste. And what I told, that what does it contains? Infectious agent, toxic, hazard agent, SARS, genotoxic agent, radioactive agent. Genotoxic means it is toxic to DNA or genetic material. That's why it is genotoxic. And some general waste also can be generated, like patient food and all. Those are only general waste. And pathological waste consists tissue, organ, like from the pathological laboratories, or any OT, operation theater also, that pathological waste can be generated. Infectious waste, that is also from can be generated from hospital and wards. By the same time, microbiological laboratory or any other laboratory, pathological laboratory. SARPs, that is also mainly any needle or broken glass, scalpel blade, these are come under SARP. And pharmaceutical waste means any expired medicine and all, that will come under pharmaceutical waste. Or any spill, means you are carrying any medicine bottle and that fall from your hand and it has broken on the ground. How to manage it? That is called spillage management. I will come to that spillage management later. Then chemical waste means any discarded solid like bleaching powder and all we are using to disinfect the environment, and some Lysol and all to clean the floor. Those will come under chemical waste. Radioactive waste, some radioisotopes, X-ray, all those things, that will come under radioactive waste. And sources, what I told, any hospital, physician office, dental office, dispensaries, blood bank, animal house, laboratories, or any research laboratories. From here we can, means these waste can be generated. And first of all, when waste has been generated, we have to keep in mind, we have to manage it. How to manage it? Some regulations are there. In 1998, the first regulation has made, and they have made some categories, around 10 categories they have made. They made the categories like the infectious or corrosive, or it is a chemical hazard, like that. They have made the 10 categories. And after that, 2016, again the new amendment has came. They have mentioned some color code, where the sharp will discard, where any infectious body parts will discard, where the plastic glasswares have to discard, like that. After that, 2018, they have made again the new amendment, and that amendment also made some color code, and they told that time that chlorinated plastic have to use. After that 2019 again second amendment has came, and that second amendment has told that color code, all those things color code, I will go one by one. And those color code, when you are discarding any sharp, any body fluid or any infectious non-plastic, there you have to put it in the yellow bin, or and on the bin direct means clearly you have to mention that it is biohazard. Next will come red color. In the red color you have to put all the non-degradable or plastic materials like syringe, gloves and all. Then will come white container. White container should be puncture proof, and there you have to put all the sharps like scalpel blade, needle, all those things. Needle with fixed syringe also it will come under white container, and white container will contain 1 to 2% hypochlorite solution. And you have to keep it in mind that 2/3 you have to fill. After that you have to seal, and you have to store it in the common waste storage area. হ্যালো, কিছু অসুবিধা হচ্ছে? অনেকক্ষণ থেকে কি হচ্ছে ডিস্টার্বটা? Then blue color will come. In the blue color, glass materials or any recyclable material we have to keep, like any glass slides, glass container, any ampoules we have to empty ampoules we have to put it in the glass container. And glass container, it can be a cardboard or anything, or it should be yellow marking. And any other waste like biodegradable waste or non-infectious waste like any food material or anything, that you have to store or you have to put it in the green bag. Genotoxic waste also can be, you have to store in the yellow bag. Okay, and that can be mutagenic, means it directly affect on the DNA or RNA. It makes some mutation on DNA and RNA. Teratogenic means that has some impact on embryo growth related deformities will be there. And carcinogenic means it can cause cancer. When at first we have to keep it in our mind that we'll try to make sure that generation means in any work, if we are generating any waste, we have to keep it in our mind that waste if it is not necessary, we will not create any waste. Okay, and after if the waste has generated, at first step it is you have to categorize. Categorize means if it is infectious or non-infectious, if it is biodegradable or any plastic material, if it is sharp, like that you have to categorize. And as per the categorization you have to put it in different bins, different color coated bins. Then you have to store it in a common storage area, and you can store in your facility like hospital or any lab. Within 48 hours you have to dispatch it. And where to dispatch? You have to dispatch it in common treatment facility or any agency. They will treat it, and as per their treatment. If it is like any bacteriological laboratory, from bacteriological laboratory, if any waste is generated, you have to at first you have to treatment in your facility, like from the bacteriological lab, any culture or anything, that you have to put it in a autoclave, and you have to make it sterilization. Then you have to store it in the common storage area. Autoclave means it will sterilize the material. How? It is an instrument in the lab, it is present, and here you have to by moist heat sterilization. The mainly autoclave principle is moist heat sterilization, like 121 degrees centigrade for 15 minutes, 15 psi per square inch, you have to maintain it, and in this process even the spore, bacterial spore will also die, and after that you have to store it in a common storage. After that, within 48 hours you have to send it for any common treatment facility or agency who will take care of it. And from where the waste has been generated, outpatient, here the solid waste means any cotton with blood, or soiled, or any pop cast, all those things will outpatient area you can find it. Injection room, there solid waste, soiled waste, solid waste, sharp, you can get it. General ward, there also sharp waste, soiled waste, and solid waste also you can find it. Labor room, body parts, placenta, etc., you can get it. Operation theatre, body parts, sharp waste, solid waste, and soiled waste also it can be generated. Like laboratory, pharmacy, in the pharmacy, discarded medicine or any expired medicine also you can find it. After that, at first you have to segregate, means when the point of generation waste is generated, at first you have to segregate in different color bin, different color coded bin. Here you can find that different color coded bins are there, means blue, yellow, red, and white. Means when a waste has been generated, as per their color code you have to separate it. Okay, means if it is sharp, you have to put it in the white puncture proof container. If it is infectious body fluids or any infectious material is there, or any cytotoxic or pharmaceutical waste, that you have to put it in the yellow bin. After if it is glasswares or any gloves, face shield, all those things, it will come under red bin. And if it is glasswares, then you have to put it in the blue bin. And when you are carrying, after storage, you have to carry for the common storage area. The route will be predefined, means predefined route you have to carry it. People should know that waste will carry in this, through this route, like that. And if it is and when you are carrying, you have to take care about that any accidental spillage or anything should not be happen, means your waste should not come out from your bins. After that, you have to store it in the common facility. You have to store it in the common storage area for 48 hours only you can store it. After that, within 48 hours, you have to send it for common treatment facility like CBMW TF, means that BMW treatment facility, central BMW or common BMW treatment facility will be there. Any agency or anything, like here we have one agency, they will come and they will collect all the biomedical waste. Sometimes you can find one car is there, that white color car, and that kind of biohazard sign is there on that car, right? That car will collect all those things and they will take it to their facility, and they will make it for further use if it is reused, or if it has to be incinerated, they will incinerate, like that they have to perform. And when you are carrying or you are handling, you have to take care about your PPE. You have to wear mask, cap, gown, any boot, gloves, different your lab gloves, it's a different, but when you are carrying waste, the gloves, it is, you can find that is a different type of gloves they are using. And particular different bags, this kind of bag you have to use, means in the red color bin you have to put a red color bag, yellow color bin you have to put yellow color bag, like that you have to. And here you can find that it is a old picture actually, cytotoxic label is there, but now black or any green bin, after 19 amendment, second amendment, that green color, or you can use green or black color bag or container for any household waste. That particular, you can find that particular trolley is there. That trolley is dedicated for that purpose only, to carry the waste and all. Okay, and when you are mentioning that biohazard, you have to mention that particular stickers like biohazard and cytotoxic, and you have to label shall not be washable or permanently. It is prominently visible, should be prominently visible, or it should not washable, like that. That kind of symbol you have to use. And this yellow bag, in the yellow bag, any anatomical waste, solid waste, any chemical waste, pharmaceutical waste, you have to put it in that particular bins. And that bag you are using, that bag should be non-chlorinated bag, because in the high temperature that those things will go for incineration or autoclaving, like that. But in chlorinated bag, in high temperature, chlorine gas will come out, and that is hazard for health. That's why that new amendment has made that bag should not be any chlorine particle, or it is non-chlorinated yellow or red or blue bag. And the treatment is you have to incinerate, or sometimes if it is infectious, like any waste from biological laboratories or any biotechnology laboratory or any microbiology laboratory, at first you have to autoclave it in your facility, means in our hospital that has to be autoclaved. Then after it will store to the common storage area. From there, that biomedical treatment, any third party, or if you have any inside your hospital, if you had any different treatment facility, there you have to carry within 48 hours. And next, it is red. There you can find that is infectious, but it is plastic or any non-degradable material like gloves, face shield, goggles, and some catheters, tubings, syringe, plastic syringe without needle, obviously without needle, syringe, those things you have to put it in the red bag. And that you have to, means the final treatment, it is autoclaving. And if it is required, you can for the treatment facility, they will make it for other purpose also, or you can generate from this kind of waste, you can generate any other energy, like that you can utilize this waste. White, in the white container, that will contain needle, syringe, and fixed needle. Obviously some fixed needle will be there in that syringe. If it is fixed, then you have to put it in the red white bag or white puncture proof container. And sometimes needle is there on that syringe, and you can make needle cutter also, or needle burner. After that, the needle will come to the white puncture proof container, and that syringe will go to the red bag. Okay. Then blue will come any metallic body implants. If any metallic body implants is there, that will come to the blue container, or any glasswares, broken or discarded any ampules or glasswares, that will come under blue container. And that can be recycled after any autoclave or any other treatment facility, that can be recycled. And obviously in the white container, you have to put 1 to 2% hypochlorite solution, and it is for 20 minutes. You have to keep it for 20 minutes, then only it will get disinfectant or sterile. That different, if it is a cytotoxic drug or any drug, that yellow, if you have to put it in the yellow bin, right? That yellow bin should be like this, a closed container like that. Yellow bin will be there, and in that bin you have to put all the cytotoxic or any genotoxic or cytotoxic drug or pharmaceutical waste, you have to put it like in particular kind of container. What I told that cardboard box you can use, and that cardboard box should be marked with or labeled with blue color tape. In the yellow category, that any animal or any animal body parts or human body parts you can discard, and even the some pharmaceutical waste also, and you have to store it in different. If it is an anatomical waste, you have to store it in a different yellow color. If it is cytotoxic or genotoxic, you have to store it in a different yellow color container. Then central storage facility, you have to store it for only for 48 hours. Always it is 48 hours you can store it for central storage facilities. Then CBMW TF vehicle will come and they will collect all the waste, and they will put it in the common storage in their storage facility, and they will make it for further treatment. Yellow category also will come, that microbiological cultures or infectious material, that you have to at first in your lab only, or inside your hospital, it has some common treatment area. There you have to autoclave it, then you have to store it, then you have to send it in the central storage facility, then send it for the final treatment. Some liquid is also there, means housekeeping cleaning part is also there, some bleaching solution, hypochlorite solution, that also you have to make, means inside your hospital. Those you should not drain it in the common drain, or you can discard it like common water or anything like that, you can discard it. Only you should have some separate collection system. In that collection system, you have to treat it properly. Then after treatment, you have to check it that you have to test that particular effluent what you are treating. Then you have to throw it in the common drain. Red category, in the red category, that you can find that some plastic materials or non-degradable materials are there. If it is like if it is NS bottle, then before throwing you have to mutilate it, means you have to cut it or you have to break it, then only you can throw it. After that, in the container you have to keep it, and central storage area, then the treatment facility you have to send. There they can make it recycle, or before recycle they have to, at first they have to sterile, or they have to autoclave it. White category, that needles and blades will come, and you have to preserve it in the white color container, or it should be puncture proof, and it should contain 1 to 2% hypochlorite solution. In that solution you have to keep it, and after that you have to store it in the central storage. Then you have to send it to the final treatment facility. There they will autoclave it, or they will heat dry, anything they can do it, and after that they have some different treatment facility. They can recycle it, they can like municipal landfill, they also can do it, and some encapsulation also is there by cement. Some sharp pit will be there. In that sharp pit, in your common facility also, in your hospital, you can make it a sharp pit, and there also you can put all this sharp with cement. Blue category, that any glass ampules or any metal that you have to discard, and that you can find that hypochlorite solution is also there. If it is infectious, then you have to put it in the hypochlorite solution. Then you have to disinfect it. After that disinfectant, you have to store it in the blue color. Then you have to store it in the central storage facility for 48 hours. You can only store, means within 48 hours that car will come to collect. Okay, and that central treatment facility you have to send it After that, they can again they can autoclave it. Again they can autoclave it, and after that, if it is recyclable, they will recycle, means glassware it can recycle, right? That's why they can send it for recycle also. Mainly that we miss, means when you are discarding all these things, you are putting yellow to red, red to yellow, or like that. That's why some I collect some material, that here you can find that nitrile gloves, it will come to the red, but we will throw it in the yellow bin. Okay, it should not throw it in the yellow bin, we have to throw it in the red. Okay, central venous catheter also it will go to the red. Okay, and in the red bag sometimes we throw blood bag in the red, but blood bag that it is contain plastic, right? Outside plastic, that's why we will wrongly will throw it in the red bag, but it will come to the yellow, because body parts are there inside, that blood is there, right? That's why you will throw it in the yellow bin. Okay, then white, in that white color, because sometimes we think that broken glass slides it is sharp, we have to throw it in the white box, but we should not throw it in the white box. Where we have to keep it in the blue color container, we have to throw it. Okay, sometimes in the blue box cytotoxic drug bottle will throw, because it is a glass bottle, that's why we will throw in the, because in the blue color coat we will put glasswares, that's why broken glasswares, that's why we will put it in the blue color container, but it will come to the yellow color container. Okay, these things we have to keep it in our mind. And that common treatment facility, incinerator, that BMW or some agencies are there from the environment, Ministry of Environment and Forest, they have that facilities, like, or means they can sometimes autoclave will be there. In our facility, what kind of autoclave we can do, that any material from microbiological lab or any pathological lab, we can make it we can autoclave it, or from the blood bank, that blood bags before throwing we have to autoclave it. But that treatment facility, they should have some autoclave, and incinerator they have, means greater than 1200 degrees centigrade they have to burn it. Okay, and do's that generate waste when it is essential. Without essential, we should not generate any waste. Okay, means inside our campus also you can find some food material or food particle, some plastics cover, here there we are throwing, means packet of ice cream and all, here there we are throwing. We should not throw like here and there, we have to put it in a particular bin. Okay, and if it is required, then only we will generate waste, otherwise we should not generate any waste. And segregate, means when you are generating the waste, if it is a plastic, you have to put it in the which bag? Red bag. Okay. If it is anatomical waste or any infectious body parts or any infectious material, biodegradable, that you have to put it in the yellow bin, means in the point of generation you have to segregate fast. Then because when you are segregating, that particular color code should be there, and you have to put it in the particular color code. And when you are any NS bottle is there, when you are generating, means when you are throwing, before throwing you have to discard at first, means you have to break it at first, then you have to throw it in the particular bin. Which bin? Red color container. This before throwing needle, means we have to discard it in needle dispenser, there you have to, or needle burner, you have to, at first you have to burn, or you have to cut the needle, then that that plastic material syringe is there. That syringe you have to put it in the which bag? Red bag, and that needle it will come to the white puncture proof container. If it is domestic waste or any in the hospital also that domestic waste can generate, there you have to put it in the green. That will depend in that hospital with green or black. You have to put it. Then when you are carrying, you have to keep it in mind that everything should be carried through a closed container and dedicated trolley. The dedicated route should be used, and don't like will not mix all the means hard glasswares, plastics, body parts will not mix it. Okay, will not mix it because in the class of needle stick injury I told the chances are there for needle stick injury or any cut injury and impact of that is any disease like HCV, HBV, means hepatitis B or C, or HIV also can be spread. Never store beyond 48 hours, means in our facility we will not store beyond 48 hours and will not overfill also. Okay, 2/3 we have to fill, and after that we have to close it. Close the container, means white color container or any container you are using. You will not fill up to the mouth. Only 2/3 you have to fill. After that you have to send it for the common storage area. Okay, and specifies when you are carrying that particular waste, the predetermined route should be there. In that route, before carrying that waste, you should have some particular time. That time, and that predetermined route should be not that much of crowd and all like that. You have to carry it. And role of, it's not the role only for doctors, all the healthcare persons or for a human being, you have to maintain all that biomedical waste, how to discard it, or any other waste also, household or any waste. You have to at first you have to segregate point of generation, what I told you in those. Then you have to proper, means today what I told that yellow, red, white, blue, this kind of color code, right? Before that, what was there? 10 different categories it has mentioned. When in 1998 that first amendment was there, that time 10 different categories was there. Now it is that only this 4 different color code is there. Household it is green. It will come around 5. Then next amendment it has also can change, right? Previously they have made that black color container should contain cytotoxic drug, cytotoxic any waste. If it is cytotoxic waste, then you have to store it in the black color. Now they have removed it. Before that also they have made that they didn't make any rules, specific rules for the plastic bags. Now they have made that rules for plastic bag. It should not be chlorinated, or it should be non-chlorinated. Like that they have mentioned. That amendment can change like that, and you have to apply this amendment when that regulatory will change. And that final thing, it is conducting training and workshop for time intervals in your facility or hospital facility. You have to teach people knowledge sharing, brainstorming, like that, where to discard, and you have to survey that discard is growing properly or not, everything it is discarded properly, or point of generation they are discarding, all those things you have to make it survey, and according to that you have to conduct training session, brainstorming, or any knowledge sharing session like that. And last, that spillage management. Spillage management means if any spill, like any body fluids or any infectious fluid or any cytotoxic fluid will uh, the, fall from your hand to the floor, that time some liquid uh, spillage will be there, and that you have to manage. That spillage is mainly two types: small and large spillage. Small spillage means it is less than equal to 10 ml. 10 ml, that is small spillage, and more than 10 ml, that is large spillage. And how to manage? If it is small spillage, management is different. If it is large spillage, the management is spillage management, it is different. In that small spillage, only on the spillage you have to put one blotting paper, and on that blotting paper you have to spray, or you have to put some disinfectant solution, like 1 or 2% hypochlorite solution, and you have to wait around 20 minutes, and there you have to display that spillage management. Means any spillage is there, that you have to display that standee, that some spillage is there. Okay. After that 20 minutes, you have to, means you have to wear or before going to the spillage management, you have to wear proper PPE, like gloves if it is required. Second gloves also you can use, primary gloves, and secondary gloves also you can use. Then face shield if it is required, face shield, mask, hair cap, apron you have to wear, boots you have to wear. Then you have to go for the spillage management. Okay. And if it is large spillage, at first you have to surround all the spillage by a cotton, means you have to make some wall surrounding the spillage by cotton or any spillage management. In the spillage management kit, some sponges are there, that also you have to make sure that spillage will not flow through the floor. After that, you have to put, means you have to fully cover that blotting paper or any tissue paper on the spillage, and on that you have to spray some disinfectant solution, like 1 or 2% hypochlorite solution. Then you have to wait for 20 minutes. Then you have to remove it, and again you have to, after putting all these blotting papers and all, you have to collect it, and again you have to spray that disinfectant solution, and with a clean tissue you have to clean it. Then you have to make sure that with disinfectant solution, or like Lysol or Domex, like that you can find it in the market also. Those things you have to spray it, and you have to clean that area. And before starting that spillage management, you have to put some display, like standee, like spillage is there, that kind of precaution you have to take. And obviously you have to put that PPE, like that, donning and doffing, previous class I told, like that you have to put it, and you have to properly manage all this spillage. Okay. Or any question? Okay, thank you.
Phase of the abdomen today. Next week we move to the head neck. The last part, the perineum. Already you are now familiar with the picture. This is the picture of the perineum looking from, as the patient is in lithotomy position. That's when edge of the table, the two legs are apart. And we viewing this, our lower part of the torso. So this is the whole picture of perineum. And for the sake of convenience, it is the midline. There is a fibromuscular, very strong body called perineal body. And we draw an imaginary line from the anterior end of the ischial tuberosity, interischial line. Divide this whole perineum into anterior urogenital triangle and a posterior anal triangle. And this posterior anal triangle, in the anus you draw an imaginary line here, vertically, the each half is known as the ischioanal fossa. And it is the urogenital triangle. And if you dissect the urogen in female, there is another opening. It is the urethra and it is the vagina. It is, if you cut the fossa, then we find the fossa colis, then we find the perineal membrane, then the upper part, previous view, superior fossa of the urogenital, inferior fossa of superior fossa of the urogenital diaphragm. এখন আমরা বলছি না, when a simple loose areolar tissue আছে, there is a loose areolar tissue, we call this endopelvic fossa. So it is this, if we cut in this section, coronal section, in a male, this is the anterior abdominal wall, this is the penis, this is the scrotum, this is the perineum, behind this is the perineum, and this is the posterior abdominal wall, right? And it is the skin. Beside there is a superficial fossa. This superficial fossa, it is the superficial fossa of the anterior abdominal wall. Just deep to the superficial fossa, there is a membranous layer of the superficial fossa. We call it fossa colis. These fossa colis and the superficial layer joined here and become muscular in the scrotum. And we call it dartos layer or dartos muscular layer. That's when this superficial layer, white and blue layer, fossa colis, they are mixed together, and in this here the smooth muscles are present. These smooth muscles we call dartos. And when it continues to the penis, again it becomes fossa and we call it fossa penis. And these fossa penis now continued like here, the superficial fatty layer known as the fossa of Camper and a membranous layer known as the fossa of Scarpa. This is the umbilicus, and above the umbilicus again 2 liters blend and become fatty layer, superficial layer. So above the umbilicus, it is the superficial fatty layer, superficial fossa. Below the umbilicus, these superficial fossa divided into fossa of Camper and fossa of Scarpa. In penis, these join together to form fossa penis. In scrotum, these form dartos muscle. Again in perineum, it spreads to the superficial fossa and the fossa colis. And above this fossa colis, there is another fossal layer, very strong fossal layer. It is the perineal membrane. Perineal membrane. This perineal membrane joined with the fossa calis, so it is closed posteriorly, but anteriorly it is open. Above this perineal membrane, this yellow is the perineal membrane. It cuts section, it looks like that, but in literally this is look like that. Perineal membrane. above the perineal membrane, previous view, there is another layer we call superior fossa of the urogenital diaphragm. কেন এই জিনিসটাকে আমরা আগে বলতাম, previously we call it, this pouch we call it urogenital diaphragm, containing muscles surrounding the urethra known as the sphincter urethrae. But nowadays there is no such muscle. Sphincter urethrae is present, but it is not outside the urethra, but present within the wall. Wallettai thick hoye geche, and we call it now distal urethral by urethral mechanism. বা স্ফিংটার ইউরেথ্রি চলতে পারে। এই পাউচটাকে আমরা বলতাম আগে ইউরোজেনিটাল ডায়াফ্রাম। সো পেরিনিয়াল মেমব্রেন ইজ ইকুয়াল টু ইনফিরিয়ার ফসা অফ দ্য ইউরোজেনিটাল ডায়াফ্রাম, and above this layer we call the superior fossa of the urogenital diaphragm. And previous view is that this is anteriorly, this is attached with the air, and so this space is closed. But recent view is that there is no such fossa. Besides, there is a loose areolar tissue is present. We call it endopelvic fossa. Endopelvic fossa. And here lies the, above it in male, here lies the bladder and prostate. And this is the urethra passing in this fashion and passing this fashion. And here is the muscle levator ani or pelvic diaphragm. So you definitely look, there is two spaces. One is here, one is here. This lower space we call superficial perineal space or superficial perineal pouch. And above this, the deep perineal pouch, because when we dissect, when the surgeon operation, it comes first, so we call it superficial, and it comes later, we call deep. So you can, by seeing this picture, you know the superficial perineal pouch or space is open anteriorly. It is open anteriorly, posteriorly it is closed. A deep perineal pouch, in recent view, it is closed anteriorly, closed posteriorly, but above it is open. But previous view that there is a definite fossa, so all the layer, this space is totally closed. But recent said it is open anteriorly. Why it is important? For clinical anatomy. I will come later on. Very interesting. And the urethra starts here, passing through the prostate, we call prostatic urethra. Then it passing through here, deep and superficial perineal pouch, we call membranous urethra. Then in the penis, the penile urethra. There are the parts of the urethra in male. Female, it is a very short, only 4 centimeter, straight one. So, one by one. So, it is the superficial perineal space or superficial perineal pouch. Description. তাহলে কি হলো যদি শর্ট নোট দেয় introduction. It is a space in the perineum, in the urogenital triangle. এরকম ভাবে প্রত্যেকটা দেখো আমি কিরকম ভাবে বাড়িয়ে দিচ্ছি just to lengthen my discussion. I know it is present here. So it is a space and pouch within the urogenital triangle of the perineum, bounded below by the fossa colis and above by the perineal membrane. Introduction শেষ. Next, boundary. Boundary, if you view the boundary, whenever anything, whether it is a deep perineal space, whether it is a superficial perineal space, whether it is a ischial fossa, you to know the boundary, you have to view two pictures here. Otherwise, in a same picture, same view, it is not possible to know the anterior, posterior, above, below, medial, lateral boundary. So we have to have a three-dimensional idea. So if we look this anterior boundary, it is shaped a superficial perineal space, obviously truncated, triangular. On each side, laterally, joint istiopubic rami. গেল? বোঝা যাচ্ছে তো? আমি এই পিকচারটা থেকে এখান থেকে এটা বুঝতে পারবো না, এই ভিউটা আসবে না। তাহলে on each side apex is by joining it is bounded by the perineal body and joining of the fossa collis and the perineal membrane. এই দেখো, so posteriorly it is closed. Above, আবার এই পিকচার দেখতে হবে, it is bounded by the perineal membrane. Below, fossa collis. বাউন্ডারি শেষ। কন্টেন্টস, কিভাবে কন্টেন্টস গুলি আমরা ডেসক্রাইব করব? ওয়ান বাই ওয়ান। স্ট্রাকচারস in male, ফার্স্ট ক্লাসে আমি বলেছিলাম এই জায়গাটাকে যদি সুপার স্কিন কাটলাম, ফসা কলিস যদি কাটি, আমরা ঠিক এরকম দেখতে পাবো। Male, it is a conjoint isquiopubic rami. The penis, urethra comes here. Urethra comes passing through the deep perineal pouch, then enter the superficial perineal pouch, and here the urethra is dilated. We call bulb of the urethra. মনে পড়ছে? একদম প্রথম ক্লাসে বলেছিলাম urethra is dilated. আমরা যদি এখানটা দেখি, it is the bladder, it is the prostate, it is the liver or pelvic diaphragm, তারপর হচ্ছে deep perineal pouch, superficial perineal pouch, এই দিক দিয়ে চলে গেল স্ক্রোটামের দিকে, scrotum, apex. So it starts here, passing through the prostate, through we call prostatic urethra, then passing through the superficial and deep perineal pouch, we call it membranous urethra. This deep perineal pouch we call membranous urethra, and here urethra is dilated in the superficial perineal pouch, we call bulb of the urethra. কি বলি? Bulb of the urethra, বাল্বের মতো। And this bulb of the urethra now continued as a penile urethra. So superficial perineal pouch আমরা urethra কোন পার্ট দেখছি? Bulb of the urethra. তাহলে এখানে bulb of the urethra in case of a male. Right? In female কি পাবো? Urethra and vagina. ফিমেলে ইউরেথ্রা নেমেছে, ভ্যাজাইনা নেমেছে, ছেড়ে দাও। আচ্ছা, নেক্সট, এটা গেল স্ট্রাকচারস। নেক্সট, মাসেলস। হোয়াট আর দ্য মাসেলস প্রেজেন্ট ইন দ্য সুপারফিশিয়াল পেরিনিয়াল পাউচ? হোয়াট আর দ্য মাসেলস প্রেজেন্ট ইন দ্য সুপারফিশিয়াল পেরিনিয়াল পাউচ? নাম্বার ওয়ান, তারপরে ফিমেলে সেটা লিখতে হবে, ইউরেথ্রা এন্ড ভ্যাজাইনা। থ্রি মাসেলস। ও আর কি স্ট্রাকচার ভুল হয়ে গেছে, সরি। মেলসে আর কি পাবো? বাল্ব অফ দ্য ইউরেথ্রা, and on either side এখানে কি রয়েছে ক্রাস অফ দ্য পেনিস ক্রাস অফ দ্য পেনিস এইখানে একটা মাস্কুলার স্ট্রাকচার রয়েছে এই ইরেকটাইল স্ট্রাকচার রয়েছে তাকে অ্যাটাচ টু দ্য ইস্টিওপুবিক রামাই and when it continued anteriorly form corpora cavernosa of the penis. And when this bulb of the urethra continued, it called corpus spongiosum of the penis. So there is a two erectile structure present here. We call crus of the penis, plural crura of the penis. It is an erectile tissue. Come on. So এখানে crus of the penis or crura of the penis. আর এইখানে কি হবে ভ্যাজাইনা ইউরেথ্রা ভ্যাজাইনা অ্যান্ড ক্রাস অফ দ্য ক্লাইটোরিস ফিমেলের ক্ষেত্রে পেনিসটা ক্লাইটোরিস হয়ে যাবে ক্লিটোরিসও হয়ে যাবে মনে পড়বে ক্লাইটোরিস ওখানে আবার পেনিস লিখে দিও না নেক্সট মাসেলস four important muscles are present here. One covering the crus of the penis, which covers the crus of the penis, we call istiocavernosus, one on either side, and one cover bulb of the penis. We call bulbospongiosus. In female, bulb of the vestibule. In male, this bulbospongiosus is single. Right and left have joined together to form a single muscle, bulbospongiosus. In female, there is an cleft. In female, there is an cleft gap. So bulbospongiosus muscle is also divided into right half and left half. তাহলে ওখানে ওটা লিখতে হবে আচ্ছা এইটা গেল আর কি ইম্পর্টেন্ট মাসল রয়েছে there are another very important muscle which is present here from the posterior part of the conjoint ischiopubic rami one on either side and attached to the perineal body. Which forms the posterior boundary of the superficial perineal pouch. তখন বলিনি কেন কারণ এইটা আমি ডেসক্রাইব করিনি বলি so it forms the posterior boundary of the superficial perineal pouch. This muscle as is transversely disposed we call it transverse perini superficialis. Transverse perini superficialis. Which steadies the perineal body. Perineal body ke fixed rakhte helps. It helps the steady the perineal body. So these are the muscles present in the male istiocavernosus, bulbospongiosus, transverse perini superficially. In female istiocavernosus clitoris, bulbospongiosus, but two in number right and left, and transverse perini superficialis. Next. Vessels. এবার ব্যাক করো তো what I have told in last class. The internal pudendal artery, first branch it gives in the istioanal fossa known as the inferior rectal artery. Then it proceeds and enter pudendal canal, it gives branches. What are the branches? Perineal branch, bulb of the penis, urethral artery, ভালো করে শোনো, deep artery of the penis, dorsal artery of the penis. These are the branches of the internal pudendal artery. And they give branches in the deep perineal pouch. দো সো এটা প্লিজ ভালো করে শোনো দ্য ফার্স্ট পার্ট stem of the artery, stem মানে কি initial part of these branches, initial part of these branches means deep artery of the penis, dorsal artery of the penis, urethral artery, vaginal artery, আচ্ছা হ্যাঁ ইন ফিমেল এটা ভ্যাজাইনাল হবে ছেড়ে দাও, urethral artery ভ্যাজাইনালটা বাদ দাও, and কি বললাম artery to the bulb of the vestibule, initial part in the present in the deep perineal pouch. All this artery must enter the superficial perineal pouch. To enter the superficial perineal pouch, it must pierce the perineal membrane. এই perineal membrane কে ওকে pierce করতে হবে। এটা pierce করছে করে enter the superficial perineal pouch. বুঝতে পেরেছো? It enters the superficial perineal pouch. তাহলে first part of the or stem of the artery is present in this deep perineal pouch and the main branches are present in the superficial perineal pouch. সুতরাং আর্টারিগুলো এখানে রয়েছে, আর কি রয়েছে perineal branches, আগেই বলেছিলাম perineal branch, first branch দিচ্ছে perineal branches, it gives of very important arteries, two arteries on each side, তাকে বলা হয় posterior scrotal artery or posterior labial artery in female. তাহলে এখানে রয়েছে এইগুলি, posterior scrotal artery, deep artery of the penis, dorsal artery of the penis, urethral artery, artery to the bulb of the penis, সেই আর্টারিগুলি এই সব জায়গা দিয়ে পাস করছে। তাহলে ইয়ে হয়ে গেল and corresponding vein. নার্ভস, পুডেন্ডাল নার্ভ আগেই বলেছি পেরিনিয়াল নার্ভ দেয়, which gives to posterior scrotal nerve, এইখানটায় থাকছে। So posterior scrotal nerve, এছাড়াও দিচ্ছে dorsal nerve of the penis, dorsal কোনো deep nerve of penis বলে কিছু নেই। So these are the nerves present in the artery. আরেকটা কি জিনিস আছে superficial perineal pouch-এ যেটা মেলসে রয়েছে ফিমেলসে নেই, duct of bulbourethral gland, duct of bulbourethral gland. এরপরে বলো there are two another important structure present in the male, a female, not in male, corresponding to the bulbourethral gland, greater vestibular gland. So এইখানটায় স্ট্রাকচারে লিখতে হবে in female greater vestibular gland, urethra, vagina and greater vestibular gland, and এইগুলি রয়েছে স্ট্রাকচার প্রেজেন্ট ইন দ্য superficial perineal pouch. Clinical anatomy, very very important, clinical anatomy. Urethra passing to the superficial perineal pouch, please ভালো করে শোনো, urethra passing to the superficial perineal pouch, এখান দিয়ে urethra পাস করছে, এখানে bulb of the vestibule রয়েছে and it urethra রয়েছে, and it sometimes it is damaged. কখন ড্যামেজ হয়? ইউজুয়ালি আগেকার যুগে যেটা বেশি ড্যামেজ হতো, দেয়ার ইজ এন হাইড্রেন্ট ইন দ্য রোডস সো দ্যাট দ্য ম্যান ক্যান go inside this drain and clear this drain, and it is covered by the round shaped cover, very heavy cover. Sometimes it is loosely attached to this hydrant, and sometimes if we put on this here, it just revolve back and hit here. বুঝতে পেরেছো কি? একটা জিনিস প্ল্যাবের মতো রয়েছে, এইখানটায় দিলে এটা উঠে এসে এইখানটায় লেগে গেল। এখন ইট ইজ ভেরি রেয়ার। ডেঞ্জারাস কি? সাম ফল ফ্রম এ হাইট, ট্রিজ গাছ থেকে পড়ছে, পড়তে গিয়ে সাম ব্রাঞ্চেস হিট হিয়ার, নিচে পড়ছিল এইখানটায় হিট করলো, অ্যান্ড দেয়ার আর চালাচ্ছে, সামনে গিয়ে ধাক্কা মারলো, এইখানে গিয়ে হুইলটা এসে লাগলো বা এনি স্ট্রাকচার। সো দিস টাইপ অফ ইঞ্জুরি ফ্র্যাকচার দিস, there is a tear of this urethra and urine comes out, and we call extravasation of urine. When urine comes out from the urethra, we call it extravasation of urine. This term, medical term, খেয়াল রাখবে, extravasation of urine. Urine. So, urine producing all time by the kidney. This extravasated urine cannot go posteriorly. Cannot. It is closed. Cannot go down. Closed. Cannot go up. Closed. But it can go anteriorly. So, urine comes out through this খুব ভালো করে শোনো, and anteriorly enter the scrotum deep to the dartos muscle. দেখো ডার্টোসের ঠিক ডিপে দিয়ে যাচ্ছে, swell the scrotum, ইউরিন জমে যাচ্ছে deep to the dartos muscle, swelling the, so scrotum is full of urine deep to the dartos. খেয়াল রাখবে কথাটা কিন্তু এক্সামিনার দেখতে চাইছে, deep to the dartos muscle. সুপারফিশিয়াল হলে এইখানটায় হতো deep to the dartos muscle. Then it enters the perineum deep to the fossa penis and swell the penis. পেনিসটাও ফুলে গেল ইউরিনে, deep to the fossa penis. Then it enters deep to the fossa of Scarpa in the lower part of the anterior abdominal wall, in a space called, কালকে বলেছিলাম মনে রাখতে, superficial inguinal space, which is a space between the fossa of Scarpa and external oblique aponeurosis with its fossa. এইখানে রয়েছে external oblique aponeurosis with its covering fossa, and এই স্পেসটার নাম হচ্ছে superficial inguinal space. So urine fill this here. এইখানটায় ইউরিন এসে গেল, ইউরিন go up, go up, go up, go up. Then in above the umbilicus, it can go up deep to the superficial fossa. And theoretically, this urine can go up to axilla. But it is theoretically possible. Practically, it is not possible. Because axillary fossa is attached here, it cannot go beyond that. So, theoretically, deep to the superficial fossa, it can go up to the axilla. কিন্তু হয় না, কেন? তার আগেই পেশেন্ট শকে চলে যায়, urine becomes stopped, or patient takes to the hospital where the intervention done by doctors, অথবা patient died. সুতরাং এটা theoretically, literally up to this is possible, full of urine, right? But theoretically it can go up to the axilla, but ওখানে লিখে দিতে হবে, it is usually not possible. The urine cannot go to the thigh, cannot. Why? Because fossa of Scarpa attached to the fossa lata, so it cannot go the thigh. থাইতে যেতে পারবে না. So this is an interesting clinical anatomy of urethra in the superficial perineal pouch. Right? Clear? এটা অনেকবার পরীক্ষায় এসেছে. কেমন? Next. Deep perineal pouch. Deep perineal pouch is very easy. Already আমি কভার করেই গেছি. Structures in male urethra, in female urethra and vagina. In male, there is another important structure present which is not present in female. It is the bulbourethral gland, Cowper's gland. Muscles. Muscles, previous view, boundary. Previous view, apex is in the inferior pubic ligament. Base is posterior border or base is formed by the perineal body and another muscle, both of a closing of the muscle, transverse. Anteriorly, it is closed by previous view by the apposition of the superficial and fascia of the urogenital diaphragm and the perineal membrane. Above, previous view by the superior fascia of the urogenital diaphragm. But recent view, there is not such fascia is present. It is only covered by loose areolar tissue known as endopelvic fascia. So it is open superiorly. On either side, conjoint ischiopubic rami. হয়ে গেল boundary. Contents, structures in male urethra, in female urethra vagina. In male, another structure, a gland known as the bulbourethral gland. Corresponding gland is the vestibular gland, greater vestibular gland, present in the superficial fascia in case of a female. খেয়াল রাখবে, bulbourethral gland in male, present in the deep perineal space, and corresponding female gland যেটা, greater vestibular gland, present in the superficial perineal pouch or space. Yellow. Muscles. Previous view, the urethra is covered on all round by the sphincter urethrae muscle, which is a skeletal muscle. But recently, এটা লিখে দেবে, recent view, no such sphincter is present. This sphincter is present within the wall, within the layers of the wall of the urethra, and known as the distal urethral sphincter mechanism. প্রথম ক্লাসে খুব ডিটেইলসে বলিয়েছি, consisting of skeletal muscle fiber bracketed rhabdosphincter plus smooth muscle fibers, taking some fibers of the pubourethral part of the levator ani. এই তিনটে লাইন লিখতে হবে। কি লিখবে? Recent view is that sphincter urethra is present within the wall of the urethra. Components part is the skeletal muscle, smooth muscle, and pubourethral part of the levator ani. In female, there are two additional muscles are present, compressor urethrae and sphincter uretrovaginalis. বাস লিখে মুখস্থ করে বেরিয়ে যাবে, এক্সামিনার ভাবে ইউ নো এভরিথিং, কিচ্ছু ডিটেলস পড়ার দরকার নেই। কোথায় কম্প্রেসর ইউরিথ্রি গেছে, কোথায় স্ফিংক্টার ইউরিথ্রি জানার দরকার নেই, শুধু নামগুলি মনে রাখবে, মুখস্থ করবে 15 বার করে। ডিস্টাল স্ফিংক্টার ইউরেথ্রাল মেকানিজম ইন ফিমেল, কম্প্রেসর ইউরিথ্রি অ্যান্ড স্ফিংক্টার ইউরেথ্রোভ্যাজাইনালিস। দয়া করে মেলের ক্ষেত্রে স্ফিংক্টার ইউরেথ্রোভ্যাজাইনালিস লিখবে না, কারণ মনে থাকে যাবে। তাহলে এই মাসেল রয়েছে, আর কি মাসেল রয়েছে? লাইক there is a muscle present in transversely from the ischiopubic rami to the perineum, which is called the fundus. Nerves ki present? Vessels, internal pudendal artery, and stem of the branches of the internal initial part, urethral artery, artery to the bulb, deep artery, and dorsal artery. First part ta এইটুকু ওই ছোট ছোট ইনিশিয়াল পার্টগুলি রয়েছে। নার্ভ রয়েছে, ইন্টারনাল পুডেন্ডাল নার্ভ অ্যান্ড posterior ইনিশিয়াল পার্ট অফ দ্য posterior scrotal নার্ভ। বাস ছেড়ে দাও, আর কিচ্ছু দরকার নেই। তাহলে ডিপ পেরিনিয়াল পাউচ, এর যদি এখানে যদি ইম্পর্টেন্ট, তাহলে আমাদের এটা শেষ হয়ে গেল পেরিনিয়ামের ইউরোজেনিটাল ট্রায়াঙ্গেল। superficial perineal space, boundary contents applied. Deep perineal pouch, boundary contents, and few applied. But next going to the this part, very important, istioanal fossa. This is the anal triangle anteriorly bounded by the perineal body and the imaginary line, kalpona korechi, interistitial line. Laterally istial tuberosity, posterolaterally sacrotuberous ligament. This is known as the sacrotuberous ligament, a ligament from the istial tuberosity to the sacrum. Sacrotuberous ligament and posteriorly tip of the coccyx and lower part of the sacrum. So this is the boundary of the anal triangle. And each anal triangle in the midline, so by the anus, it divided into two parts. This is known as the istioanal fossa. কি বলা হয়? Istioanal fossa. এটা মুছে দিচ্ছে এখন। এটা হিস্টোলজিটা ভাবো, তারপরে রয়েছে সাবকিউটেনিয়াস, এটা হচ্ছে রেকটাম। ক্যানেলের লেন্থ কি কি তিনটে ভাগ আছে পড়েছো তো, আপার পার্ট, মিডিল পার্ট অ্যান্ড লোয়ার পার্ট পড়নি? আপার পার্ট 15 millimeter, middle part or transitional zone 15 millimeter, lower line by skin 8 millimeter. মনে রাখতে হবে লেন্থ গুলি। It is the upper part and lower part. It is lined by skin. It is lined by skin. মেমব্রেনের পরে কি থাকে? সাবমিউকোসা। আমাদের এইটা কত হিস্ট্রি, সাবমিউকোসা। সাবমিউকোসার পরে থাকে মাসকুলার এক্সটার্না, কনসিস্ট অফ স্মুথ মাসল অ্যান্ড আউটসাইড লঞ্জিটিউডিনাল মাসল। তাহলে এখানে স্মুথ মাসল আমি আঁকি, the smooth muscle of the anal canal is thickened to form a sphincter known as the internal anal sphincter or sphincter ani internus, common name. এইখানে কি smooth muscle has got a two part, circular muscle and outside longitudinal muscle. আমরা হিস্টোলজিতে পড়েছি। This circular muscle is very much thickened here and form a sphincter. স্মুথ করলে কন্ট্রোল আর রিল্যাক্স করলে খুলে যাবে। and this is known as the sphincter ani internus. কেন এটা উইদিন দ্য ওয়ালে থাকছে, sphincter ani internus। এইখানে আরেকটা মাসল রয়েছে, পেলভিক ডায়াফ্রাম লিভেটার ani, which is